we got some new data from Amgen on Repatha, their late-stage, once-a-month GLP-1 weight loss injection. Now, Wall Street didn't react to the news, but this is a big biotech that's been able to pull off some major drug launches in recent years. So let's take a close look with Bob Bradway. He's the chairman and CEO of Amgen. You get a better sense of what's going on here. Mr. Bradway, welcome back to Man Boy.
Thank you, Jim. Glad to be with you.
All right. Now, first, we just got to address what people have been saying about your GLP-1 versus what the truth is. And the truth is, it's entirely possible that maybe you could get to once a quarter. It's entirely possible that you can stop it and still lose weight. You are doing different things from Lilly, and I want things, put it in context.
Well, this is the first long-acting medicine for obesity and obesity-related conditions and potentially type 2 diabetes. So we have a drug that we're studying as a once-monthly injection. We've said that we expect it can be used monthly or less frequently. We've shown what it looks like when it's used every 8 weeks, and we shared yesterday that we're very encouraged about the data for when it's used quarterly as well. So we think there are a bunch of ways to win for patients when it comes to Repatha and maintaining weight loss, and we think we can address one of the reasons that the field is struggling a little bit, which is the patient persistence issue.
Right, meaning they drop off. They
drop off.
And there's you've got 2-year maintained weight loss. This is an industry publication, just came out after your presentation. I mean, that would be rather remarkable.
Yeah, so we have studied now over 104 weeks, again, across a range of different doses to better understand what we think the appropriate way is to maintain weight loss. So we know that we can induce a very impressive weight loss over the first 52 weeks. And we're going to study that right through 72 weeks. And then we want to understand how do we help people maintain that weight loss over the long term. And we want to understand what will it take for patients to stay on this therapy. Because persistence is the name of the game. The benefit comes from being on therapy.
Yeah, like no one's willing to seem to say it, but the current drugs, 13 months, and that's it. Then people are done. And it doesn't work like that.
And the drugs provide tremendous benefit, but only when the patients are on the drugs.
Right.
And so, again, we think Repatha has the potential to be the first long-acting medicine addressing the needs of patients living with obesity or overweight.
But I do want to point out, I mean, you've got so much going on. You've got a lot of drugs. You made an acquisition, by the way, that, you know, I champion Horizon because I just said they had great stuff, but they didn't have the scale. You have basically blown out what I thought were going to be orphan drugs. Actually, they're going to be drugs for many people.
Yeah. Well, our rare disease business is performing very well. Over the course of the last year, we were annualizing at north of $5 billion, growing at double-digit growth rates. And we're very excited about what we think we can do. But no one was
thinking that could be that. You know that when you were bought, people thought you paid too much money because no one thought that these would ever altogether add up to that much.
Well, the acquisition's working very well for us, and partly because it plays to our strengths, biologics and autoimmunity. So the medicines we acquired address autoimmune conditions and are largely biologics and are at an early stage of their life cycle. And so we're continuing to explore ways and new diseases that might benefit from these treatments. And so far, so good. We're very encouraged by what we've seen.
Now, I want to talk about one of the most important drugs ever, or it should be, Repatha. I take it. Why do I take it? Because my doctors at NYU said, look, you want to cut the risk of stroke, you want to cut the risk of a cardiac event, you have to be on it. We insist on it. At first I said, no, it's too expensive. But you put down the cost of it so low, maybe everyone should be taking it.
Well, we've lowered the list price of Repatha twice. Repatha is a medicine that profoundly lowers LDL cholesterol. LDL is the bad cholesterol. So we profoundly lower LDL, and in doing that, profoundly reduce the risk of heart attack or stroke. So, for example, a few weeks ago, we demonstrated that in people who'd never had a heart attack, if we put them on Repatha on top of what was considered optimized therapy, we were able to further reduce the risk of heart attack, in fact, by 36% for people in this study. So Repatha has helped characterize the benefit of bringing the bad cholesterol down to levels that previously weren't achievable with medicines that were otherwise available in the marketplace.
Now, isn't it true that there is no level that's too low for bad cholesterol?
Well, when it comes to LDL cholesterol, Jim, lower is better. And the data have shown over and over again that lower is better. The sooner you get lower, the better. And some would tell you lowest is best.
Okay. Now, my doctors also said, look, if you want to have any shot at avoiding Alzheimer's, the only thing that's on the market is Repatha. Now, it's not meant for that, but who knows? I mean, why would they give it to me?
Well, we've studied Repatha in the setting of heart disease, Jim. So we've shown that we can prevent heart attacks, we can prevent strokes, we can prevent what are called major adverse cardiac events with Repatha by lowering LDL. We can protect the heart, we can protect the vascular system against these catastrophic things like strokes.
How do we get the word out? Sometimes I feel that there's these drugs that are remarkable, which is, look, it's every other week, it's a refrigerated shot, no one even, you barely notice it. And yet I find that only some of the major healthcare centers, major hospitals seem to know the benefit and then insist that all their patients be on it.
Yeah, well, we need Jim to continue to educate patients, prescribers, and payers about the benefits of Repatha and the importance of lowering LDL to reduce these heart attacks and stroke. Heart attacks and stroke are the biggest cause of mortality in the United States, in fact, all around the world. And the largest contributor to that is that people are walking around with their LDL levels too high. And as you point out, nobody in the United States will pay more than $8 a day for access to Repatha. Most patients are paying a small fraction of that amount. And for the benefit that provides in terms of the reduced risk of heart attack and stroke, we need to get the word out.
It's possible that that could be one of the biggest drugs of all time when the word comes out.
Well, I don't know about that, Jim, but it's an important medicine.
I think it will be. One of the reasons why I like the stock so much is the mosaic that you have of things that are just consistent. There's no patent cliff I'd be worried about. And at the same time, some of these drugs that are 3, 4, 5 billion, I think could be 6, 8, 20 billion.
Well, Repatha grew very well in 2025, and we think it will continue to grow nicely through the rest of the decade. And again, it's growing off the back of data which demonstrate that we can prevent these heart attacks and strokes.
Well, I hope people learn, and not just because of the shareholders who's experienced a 3% yield good growth, but this is a remarkable drug, one of many that you have, and it's just that people don't know about it. We got to change that.
Thank you.
Okay, that's Bob Bradway, Chairman and CEO of Amgen, a terrific stock with a great yield. Their money's back.
Coming up, after a late resurgence in 2025, is Regeneron ready to take off in 2026? Cramer's finding out their game plan with the CEO. Next.
Jim Cramer, the diehard of the dollar.
Hey, Jimmy, love the show.
My 5-year-old grandson loves to watch your show.
I have to thank you for making us money when it's there to be made.
Our world is a better place with you in it.
Don't miss a second of Mad Money. Follow @Jim Cramer on X. Have a question? Tweet Cramer. #MadMentions. Send Jim an email to madmoney@cnbc.com or give us a call at 1-800-743-CNBC. Miss something? Head to madmoney.cnbc.com.